Well, welcome to the PrescriptFit Medical Nutrition Therapy Maintenance Strategies. If you have followed the PrescriptFit program accurately, you've gone through each food phase, you've added all 13 food phases in, you've achieved your medical goals, you've reduced your medications, you've lost some weight, and now what? What are you going to do at this point forward? Well, if everything is controlled and your weight's exactly where you want it to be, then we go into maintenance strategy, which is quite simple. You are eating all of the food groups every day and you're splurging twice a week. Let me repeat that. You're eating all of the 13 food groups with the first 8, all of your meals, in phase 9 through 13 twice a week or 8 times a month. Use your calendar to mark that out over the next month and you'll find high compliance. So what happens if you've not reached your ideal weight or you've not reached ideal medical control? You have a couple of options available to you. One option, which is patients find very helpful, is to redo the 13 food phases. Perhaps you went through it 3 days at a time or 7 days per phase, and you think, maybe I can do 14 days per phase. You have a lot of weight you want to lose. Even though your medical conditions are perfectly controlled, you just want to get off another 30, 40, 50, or 100 pounds. You now can decide to redo the 13 phases with a 14-day strategy. That is perfectly fine. So maintenance is very individualized, and you may take a hiatus. You may decide, I'm going to keep my weight and my medical conditions controlled and just splurge twice a week and go forward. And in 6 months, you may decide, I want to really knock off some more weight, or I really want to get better control of my diabetes or hypertension, and you can do the food phases again, 3, 7, or 14 days. Now that you've got the experience under your belt, you've seen how the medical symptoms improved, you've seen how the medical conditions improved, you've seen how foods affect your mood and your behavior, you've seen if you're food addicted, you've seen how your family has interacted with you, positive or negative. You've seen how your work colleagues, same way. You've seen if exercise has played a role in your life. You've seen if it's started out good and phased off. So you're really dealing with a lot of different variables now. So maintenance is a crucial phase. Use your calendar workbook. It is probably the most important time to use your calendar workbook is in maintenance. If you have any questions, email me directly. I'll be happy to talk to your medical provider if you have any medical issues. It may not be a bad time to reread the book, beginning to end. If you have any specific questions, many of the times they're answered in the book. So congratulations. You've made it to maintenance, and keep me posted of your progress all the way through.